Dietary management of dysphagia in the elders. This presentation is done by Antonita and Indradeep. So, dysphagia, it's also called as swallowing difficulty. It's a growing health concern in our aging population. Age-related changes in swallowing physiology as well as age-related disease are predisposing factor for dysphagia in the elderly. Basically, a person with anatomical or physiological defect in the mouth or pharynx, larynx, or esophagus may demonstrate signs and symptoms of dysphagia. So, this causes increased risk of malnutrition and pneumonia. Age-related decrements in oral moisture, taste, smell, acuity may contribute to reduced swallowing in the elderly. So, this slide it shows the condition that causes the dysphagia. So, neurological diseases, cancers of the head or neck, and esophagus, and metabolic defects are broad categories of disease that might contribute to dysphagia. So, neurological disease like stroke, dementia, myopathy, cervical spine injury, or it could be this Parkinson's disease, Huntington's disease, or rheumatoid disease. So, types of dysphagia are oral dysphagia, pharyngeal dysphagia, esophageal dysphagia. It is divided on the basis where the problem is occurring. Both the oral and pharyngeal dysphagia they have similar symptoms, whereas esophageal dysphagia is quite different from the other two. So oral and pharyngeal dysphagia, the coughing or choking with swallowing. So there's difficulty initiating swallowing, food sticking in the throat, drooling, nasal regurgitation. Whereas in esophageal dysphagia, you can clearly see that the food is sticking in the throat and sensation of food sticking in the chest. We have a sensation that food is sticking in the chest. So that's the main difference between the oral and the esophageal. And then recurrent pneumonia can occur, drooling are some of the symptoms. So the modification that we could do for dysphagia are posture adjustment, diet modification, and swallow maneuvers. So posture adjustments, some 5 stages of posture adjustments are chin down posture, chin up posture, head turn left or right, head tilt left or right, lying down. So the figure 1 it shows all 5 positions. So chin down position posture it is helpful for those who have tongue base retraction issues. Chin up posture is helpful for those who have oral tongue population problems. Head turn left or right involves rotating the head to the side that is damaged. Then head tilt left or right. Head is tilted towards the stronger side to promote the flow of food and liquid through the same side. And then the lying down position. It is basically effective in those with posterior pharyngeal wall contraction or reduced laryngeal elevation with resulting residue and subsequent aspiration after swallowing. So another step that we could do for dysphagia is diet modification. So the IDC, which is called as the International Dysphagia Diet Standardization Initiative, they developed a standardized way of naming and describing texture modified food and thickened liquids for people with dysphagia across the lifespan. Around 590 million people worldwide have this disorder, and Canada plays a big part of the development. So, as we can see in this diagram, so food, first of all, drinks, it's classified from level 0 to level 4, and then foods are classified from level 3 to level 7. Basically, the foods are handled by the chef, whereas drinks are handled by the front staffs. So, for people who could not consume regular food, they can either consume soft bite-sized or minced moist, pureed or liquidized. And drinks also based on their food types, the drinks are given like moderately, if it's liquidized food, then a moderately thick drink can be given. For pureed people, a extremely thick drink could be given. So these pictures, they show how the minced food looks, how the pureed, and how the soft bite-sized food looks. Another modification that we could do for dysphagia is swallow maneuvers. So that is categorized into four as supraglottic swallow, supraglottic swallow, Mendelssohn maneuver, effortful swallow. So if we talk about the supraglottic swallow, this technique involves breath holding before and during the pharyngeal swallow to close the true vocal cord before and during swallowing to prevent the entry of food into the airway. So supraglottic, it is to close the airway entrance above the true vocal cord, and it requires breath holding while bearing down, which pulls the arytenoid cartilage forward and closes the laryngeal entrance at the level of the false vocal folds. And then Mendelssohn maneuver to extend and prolong laryngeal elevation and thereby to prolong the upper esophageal sphincter opening during swallowing. And then effortful swallow to increase posterior tongue base movement to facilitate bolus clearance. The patient is instructed to swallow and push hard with the tongue against the hard palate. Then texture modification of fluids and the rest of the slides will be covered by Indradeep. Thank you.
So moving forward, I'm here to describe the texture modification of solids. So dysphagia diet should be soft and moist. Meats and shrimp foods are tender and diced to 1 centimeter, which are cubed. Food that are softened enough not to require dicing can be mashed with a fork in one hand, that is, it should be fork mashable. No food that are dry, crumbly, chewy, sticky or grimy are to be served. So here is a list of food that are allowed and that are not allowed. The food allowed are the diced or fork mashable, soft vegetable and fruits. Vegetable should be minced, if not, it should be fork mashable. Soft or fork mashable pasta, moist rice, and that stick together. Soft and moist bread product, not hot cereals. Cold cereals are to be served in the softened milk. Milk products with the small pieces of the fruits, soft fork mashable or diced meat, fish, poultry with gravy. So next are the food that are not allowed. Raw vegetable, fruit with a tough skin, dried fruits, dried crumbly or chewy bread products, cold cereal that are not softened in milk, milk product with a large pieces of fruit, nuts, grains or seeds, dry breaded or battered meat, fish or poultry. Large chopped are the whole nuts and seeds, crunchy or smooth nuts, butters like peanut butters. So basically the food that are not easily chewable are not to be served. So here is an example of the meal that we can serve. It is diced beef with mashed potatoes, gravy and diced carrot. So we can serve the food that are easy to swallow, which doesn't require much chewing. So next is texture modification for the liquids. So we can see there are three stages of the dysphagia. So for the first stage, in which the people can drink through the straw, we can serve the nectar thick fluid, which can be easily poured. That is the fruit nectars, strain purees, cream purees. We can serve like mango or peach juice. So for the stage two, we can serve the honey thick, that is slightly thicker, not easily poured or as a nectar, that is liquid honey. So basically we add the thickener accordingly and make the nectar thick, honey thick and pudding thick like fluid levels. So for the stage 3, we serve the pudding thick liquid, which is hold its own shape, cannot pour, usually eaten with a spoon like pudding, yogurt or applesauce can be served. So next we have a water guideline for the patients uh, with the dysphagia, that is the Fraser's Free Water Protocol. So, it was developed by the Fraser Rehabilitation Institute and piloted in 1984, which allows the access to water to the patient following the strict guidelines, as patients with a dysphagia are constantly dehydrated. So we have a protocol which allows the access of water to them. So guidelines are: the patient preferred to LPs are first asserted using the bedside evaluation. Second, the instrumental exam followed for those who were flagged with the bedside evaluation. Then the patient who exhibit excessive coughing or discomfort by drinking thin liquid restricted to the water taken with the whilst unsupervised. Those who exhibit choking with strict NPO ordered by physician may not be permitted oral intake through its though it's rare. For the patient who take meals by mouth, they are allowed to unlimited access to water between the meals. So it should be beginning 30 minutes after the meals to allow for any solid thickened liquid residue for a meals to clear. NPO patients are allowed water at any time. So here are some staff compliance. So patient and their facility wear yellow armbands with any special diet recommendations. So they can be easily recognizable. Most of the time they say no thin liquid besides water between the meals, but sometimes have restrictions such as only water by teaspoon between the meals and any compensatory strategies such as thick truck recommended for them. So for the medication, never give the water pills. Never give the water with the pills. Pills are taken in the spoonful of the applesauce, pudding, yogurt, or thickened so that they can be easily swallowed. And most importantly, they should be having a oral hygiene. Most aggressive oral care is required for the patients to follow this protocol, especially NPOs, so that the pathogenic bacteria does not contaminate these secretions and end up in the lungs. So that's all. And for the summary, dysphagia is a serious disorder of the food swallowing. It is most observed in the elderly people of the Canada. That is great concern. They should be specific diet and liquid so that they can be easily swallowed. Number of recommendations are prescribed for such patient to follow and work on their diet schedule. Most importantly, the texture of the food and liquid, that is described above in the slides. There is a great area of the focus on dysphagia patients. Texture must be smooth, thin, without any contamination, and their caregivers must consider following the diet prescribed and provided by their physician. So that's it, and there is a references. Thank you so much.